Macon, Middle Georgia Black Pages and Resource Guide
is proud to announce that the 2021-2022 edition is now available in hard copy and
digital,
which will feature Black businesses that have substantially impacted the economy in the counties of Houston, Baldwin, Lawrence, Twiggs, Crawford, Wilkinson, Monroe, Peach, and Jones.
You will be amazed. We got over 1,600 African American businesses listed.
For over 30 years,
The Macon, Middle Georgia Black Page
continues to serve as the premier resource guide for business owners and consumers.
We give all African American businesses a free listing.
The 2021-22 edition is available now
At various locations throughout the city.
in hard copy.
Or you can go to our website, MaconBlackPages.com,
Download the app today.
for the new
Edition
of the Macon, Middle Georgia Black Pages. Pick up a book. There are many times that many of us suffer from illnesses and diseases and sicknesses that are worse than they really have to be. Oftentimes it's because of the lack of action, the lack of information, and the lack of knowledge. And one thing that we do on a regular basis on a call to action, which is the name of this show, I'm your host, Alex Habersham, and I'll introduce my guests in a minute. But we try to impart life-changing information, particularly as it relates to health on this show. And there are so many, you just be amazed, this show is gonna be on lung cancer. And you would be just absolutely amazed on the different kinds of cancer, the different locations in the lungs, the different diagnoses, the different feelings, the different organs, just on and on and on. So I'm so happy today to have with me Dr. Mohammad Khan, who is going to talk with us about many of the elements and about lung cancer in an effort to educate us and to motivate us and to inform us about this disease and some of the things that can be done. How you doing, Doc?
I'm doing well. Thank you for asking.
Yes, sir. Just tell us a little bit about yourself first.
So I work out from here from Atrium Health Medical Center in Macon, Georgia. I'm sitting in the hospital, as you can hear the ambulance siren, in the background. If you do hear it, I am a board certified pulmonologist as well as a critical care doc. That means that I am specialized to take care of patients with various lung diseases. And when they get sick and they're sick enough and where they go to the ICU, I also take care of them when they're in the ICU. Most of my work involves at medical center, in the outpatient setting is take care of, diagnosing patients with lung cancer and other lung diseases like COPD, asthma, emphysema, bronchitis. A bulk of my patients do get diagnosed with, lung cancer at different stages. So we support them, from that standpoint. Other half of my work involves recently has been involved with a lot of COVID-19 cases, patients, when they get sick and they are in the ICU. But it involves the, different spectrum of diseases. Anyone who gets sick enough and they're in the ICU, we take care of them. That sometimes, unfortunately, involves lung cancer patients as well. Yeah.
Well, thank you very much. And that's so important. So the technical name for one who specializes in lung diseases is a pulmonologist?
Yes, sir. Yes,
okay. Sir. That's good to know. That's outstanding. So let's talk some about lung cancer. I tried to do a little research on it before this interview. And now I want to back up. I want a little bit. I want to talk about having to be on a respirator, and I want to talk about, what's the relationship between COVID and being having to go on a respirator, and what kind of effect does that have on the lung,
Hmm.
the COVID disease?
Hmm. Hmm. I think that's a very, very good question. Unfortunately, we know that COVID-19 infection affects our lungs, and it can affect and have minor changes in the lungs where patients will not have any symptoms. And they may just have a little bit of cough and, it will go away. Unfortunately, but in some cases, there may be severe disease, what we call severe COVID-19 disease. The technical term is acute respiratory distress syndrome. Short form is ARDS, uh, which is a fancy way of saying that someone's lungs are so inflamed from the COVID-19 infection that they are unable to breathe on their own and they require oxygen. And sometimes when their oxygen requirement goes higher and higher, they are not able to breathe on their own at all. And then we have to put them on a ventilator or a respirator to help support them breathe. Um, it's a way of treatment. Um, and people who go on it, we rest their lungs to see if the inflammation gets better. And once the inflammation gets better, we try to get them off it. But with somebody who has such a bad disease, the chances of survival are 50-50. It's 40-60, but if you consider everything else, it can get, as high as 50-50. So people who get very sick uh, with COVID and they end up on ventilator, it's basically a 50-50 toss of a coin where if they would make it or not. And that's what we have seen so far, that some patients have been lucky enough uh, to have made it, and then there were some unfortunate families and patients who left us, and that's just the reality of the diseases.
Wow. Okay, let's talk a little bit about the lungs. And we want to first of all talk about what kind of indications or symptoms, when should we become concerned about, different actions or factors that may indicate that we've got a problem or disease of the lungs?
I think in order to say that, we have to understand the importance of lung in our body. Um, the way nature or you know nature has designed our body is, lungs are designed to not only help us breathe, but they perform many other functions. We breathe in air and we breathe out the carbon dioxide, which is poisonous basically for our body. If there's too much high levels of carbon dioxide in the blood, it can be toxic to somebody. So they not only act as help us breathe oxygen, but they also remove a waste product, which is carbon dioxide. They So what are some of the symptoms? So if somebody has any trouble, with their lungs, the most common symptom would be they can have shortness of breath. Um, it can be very mild, where somebody who used to be very active and is now, you know, who used to run is now not able to run and just able to walk, and they get short of breath. Or it could be very severe, where people can be short of breath, even when they are sitting, or they would be short of breath when they are sleeping. They can have, other symptoms like they can be coughing. We can have a little bit of cough here and there, which is fine. We all have that. But if somebody has cough that doesn't go away despite, taking medications and, doing home remedies, and the cough just doesn't go away, that may be a symptom of an underlying problem. Sometimes, in severe cases, they can have symptoms of chest pain. It may be cardiac in nature, where they can be having an angina, which is, similar to a heart attack, but it could just be from a lung disease too. Um, they can have, a variety of other symptoms, like they may be coughing up phlegm, which is basically mucus, or they may be in severe cases coughing up blood. With lung cancer, the other thing to watch for is weight loss. I mean, if you have weight loss and you have been a smoker all your life, and you have weight loss or you're unable to gain weight for unknown reasons, and you're around the same time you're getting short of breath too, it means that there's something going on. My message to the especially people who smoke, I mean, apart from them, I really want them to quit smoking is to keep an eye on their breathing. If they're getting too short of breath, they're getting too winded easily, they're getting coughing spells every day, they're losing weight, those may be symptoms of some underlying lung disease, not only just lung cancer, but it could be COPD, it could be emphysema, it could be bronchitis, whole spectrum of diseases that can come with lung cancer.
Okay, that's kind of outstanding. Walk us quickly through, the difference in bronchitis and COPD and asthma. I know those are diseases of the lungs, but just talk about the effects of them and the symptoms and how they can be diagnosed.
So, you know, bronchitis and COPD and asthma are the best way to say it is that in many ways, their symptoms are almost similar. Now, with asthma, let's start with asthma. Um, Most of the time, asthma is a disease of young age. We see a lot of that in children. We see a lot of that in, where they would, be coughing up a whole lot. They would be wheezing, and and it would get better once they get started on inhalers. As they grow older, most children outgrow it, and they just do fine during their rest of their adult life. But a lot of times we see some of that linger into adult ages, or sometimes we see that patients who have history of childhood asthma would have a second flare up in later half of their life in their 30s, 40s, 50s, sometimes even. And they would get, and they may not have smoked all their life. I mean, they may just have been, non-smokers, and they would certainly start getting short of breath. They would start having chest tightness where the chest feels tight. They would be wheezing, which is like a whistling sound when they're breathing. Uh, and that may be asthma. And they may be coughing a whole lot. And there are certain tests called breathing tests which can be done to diagnose asthma. And the treatment would be inhalers. And most of the time, asthma is an allergic reaction to something up in the environment. It could be, something, as simple as animal dander versus could be, smoke, cigarette smoke that causes a trigger. Most of the time, asthma is triggered by something. Because it's not every time, but most of the time, it's an allergic kind of a reaction. On the other hand, bronchitis and COPD, we usually see in smokers, at least in first world countries, developed countries where it's mainly a disease of smoker. Patients would have been smoking for 30 years, 40 years, and they started at a very young age, and now all of a sudden they are feeling short of breath and they're coughing. And so bronchitis is usually, patients would be have cough mainly. They would be coughing mainly in the morning, at night, and during the day. Versus when they start having problems with breathing, it means that they are turning now into more into what we call COPD, where the lungs are affected as well. And then they would require, treatments. And the most important, single most important treatment is, they need to quit smoking. And even, sometimes even after quitting cigarette smoking, they would still be short of breath, and then they need certain kind of therapies like inhalers. And in severe cases, a lot of patients can end up on oxygen, long-term oxygen therapy, basically. Um, but all these diseases, asthma, COPD, and bronchitis, are basically more or less similar diseases because of different reasons, but on the same spectrum, they can have similar symptoms.
Oh, that's very interesting. Now, is it possible to live with one lung and talk a little bit about uh, operation surgery? I mean, is it possible to have lung surgery? Is surgery a possible solution to some of these problems?
So, unfortunately, most of the time, when the patients get diagnosed with very advanced disease, I'm talking about I'm talking about COPD. I mean, if that's what you're asking me, or are you asking about the lung cancer?
Let's talk. Let's talk about either. Let's do both.
Okay.
Okay. All right.
So let's start with lung cancer first. Unfortunately, lung cancer, by the time it is diagnosed, this in this day and age, by the time it gets diagnosed, most of the patients get diagnosed when they have symptoms. And most of the patients, when they start having symptoms, it's already too late for surgery. So they are diagnosed in very late stages, stage 3, stage 4, where surgery gets out of question. And the only option left is basically chemotherapy or radiation. So the way I tell my patients is that when you start having symptoms and you get diagnosed with lung cancer, most of the time, almost like 9 out of 10 times, it's already too late for to call a shot for surgery. Um, the lucky ones who get diagnosed early, because they underwent a lung cancer screening program where they went and talked to their doctors, and the doctors identified risk factors, and they were able to have a lung cancer screening, and they found that the patient, that they had a little small lung cancer, and it was early stage. If you take that cancer out, they can almost have a normal life expectancy. I mean, they say that life expectancy for a stage 1 lung cancer, is 92%, which is almost as good as anyone. Versus if
So you
somebody,
can. So are you saying that if in fact it's caught early, very early,
Mhm.
getting it out, does that mean surgically? Is
Surgically,
that how you get it out?
you take it out by surgery, where that part of the lung where you have cancer, we remove it. And then their 5-year survival is 92%, as compared to
Wow.
if it's late stage cancer, stage 4 cancer, their 5-year survival is less than 1%. So we're talking
Okay,
about,
let me ask you this. Let me ask you this quickly because somebody wants to know. Matter of
yeah.
fact, I want to know. So what process, what procedure, what should we do? Like when we oftentimes see, I never think about, my lungs. I breathe every day. But my point is, what kind of specific tests or diagnosis or examinations should one make a part of their routine, whether they smoke or not, to make sure that that they are breathing right and don't have cancer?
I see. So let's start with what the guidelines say, what the medical guidelines say. So the medical guidelines say that if you are a smoker and you have smoked for at least 20 years, a pack a day, and are currently smoking or have quit smoking, but you haven't quit more than 15 years. I'm going to repeat it. If you are a smoker and you have smoked for 20 years and are currently smoking or have quit less than 15 years, and you are anywhere between age of 50 to 80, and in some cases 85, between 50 and 85 is what I say, you should ask your doctor to screen you for lung cancer. And the way you can screen for lung cancer is they can do a test called a CT scan. A CT scan is a test which is basically a specialized kind of an X-ray. Instead of X-ray giving you just one picture of the lung, it gives you different areas of the lung in cross-section, gives you a much better image quality. So the guidelines say that if you are 50, anywhere between 50 and 80, 85 years old, and you have smoked for good 20 years or so, you should ask for to be screened for, lung cancer with a CT scan, and a primary care doctor can easily order it. And this is what the guidelines recommend for all the people who have smoked or have quit smoking but are still within those 15 years of time. As for people who don't smoke, it is not recommended because the risk of cancer in non-smoker is basically less than 1% or 1% versus risk of cancer in those people who smoke is 90%. So we're talking about patients who have never smoked, 1% risk of cancer versus those who have smoked is 90%. So that's a very high risk. So smokers should, if they are of certain age, should ask for to be screened for lung cancer with a CT scan, and that can be done at the primary care's office, or they can go see a pulmonologist. But this is what is recommended. Now, as far as symptoms to watch for, again, anything that's unusual. If you are losing weight for no reason, if you are unable to gain weight for no reason, if you have a family history of lung cancer, if you have had certain kind of exposures apart from smoking, for example, you had exposure at some point in your life where, you worked in a factory or lived in a house which had asbestos. Asbestos is a known risk factor for lung cancer. Or, you are having difficulty breathing, or you're coughing for no reason, you're coughing up phlegm, or you're coughing up blood. All those things are basically warning signs for any lung disease, and that would include lung cancer.
So I guess we were suggesting, I think it's kind of strange that smokers or non-smokers that, we don't really put a lot of thought into really getting tested,
Right.
So I think this is very, very worthwhile. I think it's very, very important that you are imparting this information. So what I'm understanding you to say is that when you go to your family doctor, general practitioner, or whomever, then and we all go every year, to get an exam. But
Right.
frankly, we don't even think about, and a lot of people used to smoke and they quit less than 15 years ago.
Right.
So we don't even think about the fact that what we should do is ask our physician. So what do they do? Give us a referral to take the test?
I think what then the physician would do is he will order a CT scan,
You
and
saying
then
C, you saying CT?
a CT scan, yeah,
Okay.
CT scan, or we sometimes call it a CAT scan, to order a CT scan, and whenever the order is done and the CT scan is performed, it can tell us how the lungs look like, and that can pick up um, nodules or any kind of abnormality in the lung. And if it shows any kind of abnormality, then those patients get referred to us. Say if it shows a spot on the lung, a spot or a nodule. Nodule is basically a little spot on the lung. Those patients get referred to our clinic here, to a pulmonologist, and then we can talk about doing a biopsy. And if we biopsy it and it comes back as cancer, and it hasn't spread to any other part of the body, then I refer those patients to our surgeons, and the surgeons can take those spots out, take those cancer out, and again, if it's early enough, I mean, if they're lucky where we caught the cancer early enough, they will have a normal life expectancy, you know, versus if it's a late stage cancer, then their mortality is very high.
So the long and short of it all, for those of us, and then I know you've said it, but I want you to repeat it. So for those of us who stand the 92% chance, or whatever that high percentage rate is, of developing lung cancer as a result of smoking, I want you to quickly walk through again what things we should look for.
So again, if you are a smoker and you are between ages of 50 to 85, and you are actively smoking or have quit smoking less than 15 years, you should ask your primary care doctor or your general doctor or anyone, whoever you see, to do a lung cancer screening. And the way that lung cancer screening can be done is through a CAT scan or a CT scan of the lungs that can identify any abnormality. For everyone else, or even smoker, um, even at younger ages, the symptoms to watch for would be shortness of breath, cough, weight loss, coughing up blood, chest pain, or anything that feels unusual. They should seek medical attention.
Thank you very much. This is a call to action. I'm your host, Alex Habersham, and I'm so appreciative to Dr. Khan for this very, very informative and educational interview as it relates to the lungs. He's a pulmonologist and has brought us a whole lot of information as it relates to this. And those of you who have relatives and friends and colleagues, share this information with them because it may save somebody's life. This show is available on Alex Habersham YouTube. It's available on Bounce TV at 6:30 and 8:30 on Sunday mornings. It's available on Magic 100 at 8:30 on Sunday mornings. It's available on makingcalltoaction.com all the time. So this information is extremely important, and you will be doing somebody a favor, maybe saving somebody's life if you were to refer them to this information. This is a call to action. I'm your host, Alex Habersham, and I want to say again, Doc, thank you very much, man. It's been phenomenal. It's been absolutely phenomenal. And we're going to take heed and take caution so we can breathe a long time. This is a call to action. I'm your host, Alex Habersham. Thanks again, Doc. Have a great day.
www.makingblackpages.com. Macon, Middle Georgia Black Pages and Resource Guide
is proud to announce that the 2021-2022 edition is now available in hard copy and
digital,
which will feature Black businesses that have substantially impacted the economy in the counties of Houston, Baldwin, Lawrence, Twiggs, Crawford, Wilkinson, Monroe, Peach, and Jones.
You will be amazed. We got over 1,600 African American businesses listed.
For over 30 years,
the Macon, Middle Georgia Black Page
continues to serve as the premier resource guide for business owners and consumers.
We give all African American businesses a free listing.
The 2021-22 edition is available now
at various locations throughout the city
in hard copy,
or you can go to our website, makingmblackpages.com.
Download the app today
for the new
edition
of the Macon, Middle Georgia Black Pages. Pick up a book.